Hi, my name's Amy Gancho, and we're going to talk today about chronic pain and opioid alternatives. So, just a little bit about the topic in general. So, chronic pain is one of the top opioid indications, according to Gruel and Hooker. Um, Besides chronic pain, it is also used for acute, cancer related, post surgical, and vascular pain. It is also reported that 5 to 8 million people use opioids for chronic pain, according to Gruel and Hooker. And these graphs that you're seeing on the right to the screen are from the CDC, and they are talking about the dispensing rate in 2020 and then also 2015. So 2015 to 2020, there was a decrease in the amount of dispensing that people are doing per state, but there's also still higher rates in some states, and the low rate is over or less than 64.1 per 100 people, so that's still 64 people out of 100 that may still be getting just prescribed opioids. So, in relation to physical therapy, it is important to understand that chronic pain is a diagnosis that we can see within a clinic. So, we need to know how an opioid, if the patient is taking it, can affect them, because that can affect our overall treatment that we can give that patient. So, first, opioids treat the pain symptoms instead of the underlying issue. And this is regarding the opioid mechanism of action. So Gruel and Hooker talked about the mechanism of action and how it works on the presynaptic and postsynaptic clefts, and it is to reduce pain transmission. So it blocks the transmission through, so the pain can still be occurring, but the transmission doesn't get through, so then we are not able to feel it. And this also is an exogenous opioid instead of endogenous, which is within the body. So this can also make our body dependent on the exogenous opioid release instead of the endogenous opioid release that we can make within our body ourselves. And then also just the side effects in general. So some common side effects that Gruel and Hooker talked about were constipation, nausea, vomiting, and dizziness, and also the central nervous system depression. So with central nervous depression, we can have reduced respiratory rate and sedation, and this can affect their level of consciousness. And overall, it is important to understand these things, because if a patient is on an opioid, we could be seeing these symptoms and then we won't be able to treat them the way that we originally were planning on doing. So it is important to understand that the mechanism of action only treats the symptoms, and they're still going to have that pain underneath it and could be masking that pain completely, which could affect our treatment overall. Now that we understand how opioids affect the body in general, it is important that we look at alternative ways that we can implement increasing the release of endogenous opioids, so then the exogenous opioid method does not have to be used. So according to Darnell et al., endogenous opioids are actually a natural pain modulator, which can help the body relieve its pain on its own. And Darnell et al. Looked at how education and sessions of cognitive behavioral therapy actually were able to improve endogenous opioid release. And based on these guidelines, so looking at efforts to change thinking patterns through developing confidence in different abilities, and also looking at behavioral patterns and using techniques such as mindful meditation, we're able to increase this endogenous opioids. Now that we understand that cognitive behavioral therapy can play a role in increasing endogenous opioids, here is a specific way that we can implement it within our practice and some certain guidelines that we can follow so that we can take this to our patients in the future. So, specifically looking at developing confidence abilities within our patients, the American Psychological Association described that practicing cognitive behavioral therapy and improving confidence abilities is through reflection and also growth mindset. So, first, look at reflection. Some ways that we can recommend this to our patients is they can participate in some personal journaling. So we can recommend that they get a journal or provide them with some resources to get one. And if they write down their thoughts and look at that, that can help them be able to reflect on their abilities and their confidence level. Also, recommending communication with others is very important. So, this link here is going to help them look at different groups that they can attend, and they can just have communication with other people that are similar in their situation so that they have a social group when going through this time. And then also just looking at the growth mindset. So I provided a link to a growth mindset scale that you can provide to your patients every so often. You could do it every week, every month, or just however long you're seeing them. And by improving their growth mindset, they're able to build their confidence because one little thing could not get them down because they don't see it as a failure. They would actually see it more as a way to grow instead. And then also I listed a book that you could recommend to them. There's plenty of different mindset books, but this is an example and it's by Carol S. Dweck, and it just talks about how you can change your mindset in certain situations, and by them reading this they may be able to start to understand what they are meaning by a growth mindset when we explain it to them. So now for the behavioral side of the cognitive behavioral therapy is an example of mindfulness meditation. So this video on the right is a 10-minute meditation video for beginners that you guys can look at on your own time. And it shows you how to practice mindfulness meditation so then you are able to teach it to your patient. So what I recommend is after you watch it and know how to do it, you take time during your sessions with your patient to teach them how to do it, and then you provide them the opportunity to teach it back to you, and this will help you know that they understand how to do the mindfulness meditation. And then after you guys have spent this time during your session, you can provide them with the resources to do it at home, and then just always check up on them on the future sessions when they come in, so then you know if it is working or if any adjustments need to be made. There are different lengths in videos, so this is 10 minutes, but there also are 2 to 12, even more. It really just depends on what the patient needs to be able to regulate their emotions and be in the moment. And then just to follow up on everything we've talked about, the examples that have been given are ways that we can increase the release of endogenous opioids, which are alternatives to using opioids instead. So with this, I hope that you guys understand that opioids cannot always be the first choice, and we can look at different ways where opioids could not be used instead. And here are all the references that I used for this presentation today. The last reference is actually the website that you can use for your patients if you need them to get group therapy or any treatments. So that is a very good resource that I would look at if you need anything in the future. And then also number 6 is the growth mindset scale, and it has the link there of where you can get the questionnaire for your patients.